Duhan, you not recording.
Oh,
Thank you.
and I missed what you said about turning in something.
For the brochure, the farm brochure.
I missed what you
have
said about turning in something. I don't know why it wouldn't let me in. I was trying to get in.
All right, so for the brochure that you have due for this class for pharmacology, it's due on
Yes.
on the 19th.
Okay.
Okay. If you have any problems uploading it into Canvas, then you'll have to email it to me because I can't change the due date now that there's been people turning in the assignment already. Okay.
Okay. And we could just take a picture of it and upload it. Is that okay?
Did you do it by hand?
Yes.
Okay. Yeah. If you did it by hand, you'll have to take a picture and upload it. If you can scan it into using your computer, that would be the best thing.
Okay. Or we could type it because I did it by hand, but I can transfer it. It doesn't matter. Either way.
I mean, if it's already done by hand, you can just scan it in and upload it.
Okay. Yeah. Sounds good. Thank you.
Alrighty. So let's go ahead and start with the ear. You know your ear parts, you got your external ear, your middle ear, your inner ear. And you know, you guys have covered hearing in A&P, I'm assuming. I should hope so. I don't think you have any more lectures.
Yes.
Good. Right. So we know hearing is the main function of the ear, and it happens when those sound waves are moved through the air, through the ear canal. So that's how you hear. Right. So if we're given drugs to manage some ear problems, then we're really looking at infection and or inflammation. Typically, you're going to see those infections or inflammations around the middle ear or the external ear. Okay, so we're typically going to give those antimicrobials and anti-inflammatories. They're usually given systemically. So anti-inflammatories, we're usually taking ibuprofen. That usually helps with middle ear pain. And they're usually going to give something like amoxicillin if you are taking, if you're having some middle ear infection. All right. And those are most often given. No, there's no pre-recorded lecture today. It's just me. Sorry. I'm sorry to disappoint you. So those are most often given by the oral route if you or your child has to have those medications. If it's a terrible infection, then you may have to get some IV medications, but typically they're most often managed with oral meds. All right. So for the external ear, we talked about this yesterday, so I'm not really going to cover this a whole lot right now. Most external ear infections or inflammations, they usually can be managed by some sort of topical drug or the otic drugs, right? If you have an excessive buildup of cerumen, then you use the ceruminolytic drugs. Right? Remember, you're always going to wash your hands first, put on some clean gloves. If you're giving this medication, please warm it up a little bit, roll it between your hands, because we said if you give cold eardrops, what can that cause?
Discomfort or pain or dizziness.
Yes.
Yeah, I said dizziness, but I was on mute. Sorry.
Yes. It'll cause, yes, Ms. Johnson, it can cause vertigo or dizziness, some discomfort there for the patient. So make sure you kind of warm that up a little bit before you give it. Make sure the ear is clean before you give any medications to the ears, all right? If there's any type of drainage coming out of the ears, make sure you clean it off before you try to put medication in, all right? If needed, after you've given the medication, you can place a cotton ball in the ear canal for about 15 to 20 minutes, just to allow for drainage, but then make sure you take it back out. And if you have a patient who is over 3 years old, which way are you going to pull the pinna to administer the ear drops? Up, up, up. Up and back. So if you have it
Over 3 or under 3?
Over 3.
Oh, my
Oh,
bad.
I thought you
Up
said
back.
under 3.
That's what I thought
over
too.
3. No, I said
Yeah,
adults
that's why I said
and kids
down.
over 3. Adults and kids over 3, you're going to pull the pin up into the back to administer those medications. If it is a child under 3 years old, you're going to pull the pin, or not the pin, but you're going to pull the ear down and back. Okay. Oh, why is this on here twice? Isn't this the same thing we talked about? We just talked about this. Okay. Drugs to manage those ear problems. Make sure, like I said before, you're going to wash your hands before and after giving those ear drops, because most likely you've put on some gloves before you did it. You need to make sure you wash your hands before and after. You said warm it in your hands. Who said this? I feel like this is a repeat of the last slide, right? I don't know what's going on here. I don't know why that slide's on here twice. But now let's go to some eye problems. You know, your eyes connected to the brain. If your brain's not working right, then your eyes might not work right. Who knows, right? Together, they allow foresight or your vision. And any drugs that we're going to give for eye problems are going to be called ophthalmic drugs. Okay. And they typically come in liquid drops or some sort of ointment form that you'll either place on the eye or in the conjunctiva or the conjunctiva. Right. So drugs for the ears are called otic drugs, and then drugs for the eyes are ophthalmic drugs. Right. So let's talk about glaucoma. All right. This is one of those eye disorders. All right. And it is caused by a large amount of aqueous humor that's produced by the ciliary body, and it causes increased pressure on the eye. So if that's the problem, then we need to take some sort of medication that's going to help that drain and hopefully not have as much of that aqueous humor produced. So we're going to give drugs that are either prostaglandin agonist, beta adrenergic antagonist, alpha adrenergic agonist, cholinergic drugs, or carbonic anhydrase inhibitors. And we're going to talk about each of those things. So like we said, glaucoma it's the eye disorder, and it comes from there being too much of the aqueous humor. Right? And this is what happens with glaucoma. Normally you would see this whole shebang. If you're just looking outside at the children playing, that's what you're going to see. But if you have glaucoma, because of that increased pressure, you have a very small window of what you're seeing. Okay. Right. And I don't know that, I'm sure that this is covered a little bit more in depth in Med-Surg. This is just a little gloss over to help you with the medications. All right. All right, so let's talk about prostaglandin agonist. All right, remember your prostaglandins are like, they're kind of hormone-like. They kind of control processes like inflammation, blood flow, things like that. Okay? So for these types of medications for glaucoma, these are going to bind the prostaglandin receptor sites in the eye, and they'll relax your eye and blood vessels, smooth muscles. All right, so that we can try and get rid of some of that pressure. Examples of those medications are, oh Lord, help me with these words, bimatoprost, latanoprost, and travoprost. I think that's how you say them. Sounds good to me. So the Prost, all the Prost medications, I mean, it's kind of in the name of it. The prost at the end or the prost at the end is prostaglandin, however you want to say it. So just remember that that is what those are for, okay? If you are giving these medications, you need to remind your patient and be mindful of the fact that there are some expected side effects or adverse side effects, which would be eye itching, redness, infection, maybe a little bit of asthma, some corneal erosion that can happen as well. Your eyelashes might grow a little bit. Do tell your patients that we're not giving them this medication so that their eyelashes can grow. So please let them know, don't take it extra because you want longer eyelashes. Just go down to the lash place and get your lashes placed on like everybody else. Or if you're having eye problems, it's probably not a good idea to worry about your eyelashes at all. Let's worry about your vision first. And then when we fix that, we can worry about your eyelashes, all right? All right. This medication can also change your eye color. So these are the things that you must tell your patient so that they're not scared and decide not to take the medication if they see any of these occur. Okay. All right. Like we said, if you know your patient is taking this for one of their eyes, because glaucoma doesn't have to affect both of your eyes, it could be on one or the other or both. We're not going to put that medication into the unaffected eye just so we can get longer lashes, okay? So remind your patients that we're not doing that. All right. Make sure you're checking the eyes yourself as nurse for any signs of trauma. And like I said, let your patient know that it can change their eye color. Okay.
Mr. Han,
Uh-huh.
is that like a permanent change in eye color or is just temporary?
That I do not know. I mean, I don't know. I can't even give you a full answer to that. I'm not sure. But I know who knows. Let's see here. Can
Google or the book?
I don't have my book with me. Prostaglandin otic drops cause permanent eye color. Let's see here. All I'm getting in my initial searches on my friend Google here is that it does do the eye change. I would have to actually do a search to see if it's a permanent or if it's a temporary. But either way, you know, just let your patient know that there will be a change. There could be a change in eye color related to it. It's a good question. All right. Then we have the next class of meds for otic drops or ophthalmic drops, excuse me, beta adrenergic antagonist. All right. And these are used to reduce the amount of aqueous humor that's produced from those ciliary bodies in the eye. So these are the LOLs, all right? So the betoxolol, timolol, and levobunolol, all the LOLs, right? So remember that those are the ones that are for reducing the amount of aqueous humor that's produced in the ciliary body of the eye. And that's what we want ultimately because we're trying to reduce the pressure that's in the eye, and you can't reduce the pressure if the aqueous humor if there's too much aqueous humor in the eye, okay? Right, so some expected side effects or adverse side effects from this medication would be temporary blurring of vision. There may be some slight burning, some stinging, maybe some tearing Your adverse effects for this medication is that it can be systemic. So remember when we talked about those drugs yesterday, when we said when we're administering these medications, if there's medications that we know can go systemic, then we want to put pressure right there by that nasolacrimal duct to try and keep most of that from going systemic. All right, because if it goes systemic, then you can have a decreased heart rate, decreased blood pressure, and heart failure. Okay, so that's from the LOLs. Okay. Like we said, we're going to perform that nasolacrimal occlusion, which means you'll put a little bit of pressure right there by that nasolacrimal duct where we showed you yesterday once you give those eye drops, because you don't want this going systemic. Once you give it, you want to make sure you're checking those vital signs to ensure that you don't have a drop in your blood pressure or your heart rate and things like that, all right? If your patient has diabetes, then you want to make sure that you're rechecking that blood sugar because it can mask the symptoms of hypoglycemia, all right? So that means that your patient's blood sugar could be dropping, and the normal signs and symptoms that we would see of someone who is hypoglycemic may not manifest because of this medication. So make sure that you're checking their blood sugar. Tell your patients, please don't drive at night. All right, we already know that this can cause blurry vision. All right, so we don't want to do that. And make sure your patient's using good lighting so when they're reading, all right, because their pupils will be sluggish to dilate. So they need to have adequate lighting. All right. Then we have the alpha adrenergic agonist. All right, and these also are going to reduce the amount of the aqueous humor that is produced in the eye. All right, so an example of this would be apraclonidine. It's just like, it sounds just like clonidine, which we also give for blood pressure as well. So you can kind of put those together if you want in that same kind of class there. All right. If we're giving these medications that are alpha adrenergic agonist, you can see some of the expected side effects would be tearing, redness, a little bit of blurred vision, and maybe some burning or stinging. And some adverse side effects could be bradycardia or tachycardia. All right, so we want to make sure that we're monitoring our patients' vital signs when they're getting this medication as well. Okay. So far we said that which class of these medications can have the side effect of changing your eye color.
That's expected.
Prostaglandin agonist.
Very good. Your
Oh,
prostaglandin
yeah, so
agonist.
which ones? Okay.
Your prostaglandin agonist. And thank you, Ms. Brockers, for that note there. On page 336 in your book from Ms. Singleton, this is for your question. It says the eye color change is gradual and permanent.
Dang.
Thank you, Ms. Brockers, for that.
Mhm.
So
Doesn't
yes,
it change to like a light blue? Because I think my grandpa had that, and his eyes were brown, and then on the outer was kind of bluish.
oh, I don't know what color it would change your eyes. It's a possibility. Yeah, I don't know. I know maybe my great grandpa, his eyes were gray. And I don't know if that was because of him or because old or what. I just remember him having really cool eyes. They were real, they weren't fake. It wasn't a glass eyeball, so I don't know what his affliction was. I do know that if he's like my grandma, he was not taking any medications to make them change that. I don't know if it was just old age or what it was. I have no idea. All right. So what is one of the things that we need to be sure that we're doing as nurse? If we have a patient who is getting a beta adrenergic antagonist,
Checking their blood sugar.
check their blood sugar if they're diabetic. What else?
Checking their vitals for their heart rate
Yes, checking their
and
vitals.
their blood pressure.
Very good. We're gonna check their vitals. And there's one more thing. When we administer this med, what are we gonna do?
Put it closer to the duct so that it doesn't cause systemic effects.
You want to occlude the duct. So once you put those medications into the eye, you want to make sure that you're putting a little bit of pressure right there, right where that nasolacrimal duct is. Okay. So that it does not go systemic. Very good. All right, back to the alpha adrenergic medications. We said that this is one of those meds that can reduce the amount of aqueous humor that's produced in the eye, right? So very important, we want to tell our patients, don't rub your eye, okay? It might feel like there's dirt in your eye, but don't rub it. Honestly, none of us should ever be rubbing our eyes. That's real talk, right? Because our hands are just disgusting. So it's best practice not to be sticking your fingers in your eyes anyways, unless you know you just washed them. But for this patient that's taking this type of medication, tell them not to rub their eye, even though it feels like there's dirt in it, okay? Once again, we want to monitor their vital signs. And why should we monitor the vital signs for someone taking this medication?
Or
Doesn't this one possibly lower the blood sugar?
This one is,
tachycardia and bradycardia.
there you go.
Okay.
This one can cause tachycardia or bradycardia. So you want to monitor those vital signs for that reason. All right. Very important, if the patient is taking an alpha adrenergic agonist, make sure that you're waiting at least 5 minutes before using any other eye medications. All right. You don't want them to interact with each other. All right. Next, we have the cholinergic drugs. This one also works by decreasing the intraocular pressure. That's what IOP is intraocular pressure, by reducing the amount of aqueous humor produced, and will improve its flow. So this is going to help the flow of the aqueous humor from the eye to wherever it ends up getting reabsorbed in the body. All right. So your examples for cholinergic drugs would be carbachol and pilocarpine, or that's how I'm going to say it. Pilocarpine and carbachol. Okay. Right, so for this one, you do have some expected side effects for these medications as well. Your patient may feel tearing or excessive tearing. They may have some stinging sensations, redness of the eye, photophobia. They may have some blurred vision as well. Some adverse effects for them could be blood pressure changes. They may end up having some abnormal heart rhythms. So I would imagine, especially if a patient is in a facility or if they've had surgery, most likely they're going to have them on telemetry so that they can monitor their heart while they're, beginning this medication, so that we can see if there's any abnormal heart rhythms coming from it, right? And if your patient is taking pilocarpine or pilocarpine, however you're going to say it, they can have diarrhea with it, okay? Usually glaucoma affects older people. So remember, with older people, diarrhea can be an emergency because it can dehydrate them very easily. All right, so if your patient is taking this pilocarpine, make sure that they are notified if they start to have diarrhea. That's not a side effect that we want to see for them. For these patients taking the cholinergic drugs, make sure that we tell them that they should be avoiding any nighttime driving. Right? They should wear sunglasses because this can cause photophobia. We need to monitor their heart rate and their blood pressure. This one again, we're going to be applying pressure to that inner canthus over to that area so that we can try to prevent any of those systemic reactions from happening. And if your patient starts to drool or sweat, that could mean that they have some sort of drug toxicity. So that's something to absolutely report to you, the nurse, if they're in a facility, or to the physician if they're at home, because we may need to change their medication. Okay. So you're going to report drooling and sweating for cholinergic drugs. That means that they're having some sort of drug toxicity. Okay. All right. Which one of these meds can cause diarrhea?
The one that start with a P.
Very good. The one that I cannot pronounce properly, I'm 100% certain that I'm butchering that word. All right. And then the next one is the carbonic anhydrase inhibitors. I think this is the last one for your ophthalmic drugs, I believe, for glaucoma. Yes. All right. So this one will lower your intraocular pressure by reducing that aqueous humor in the anterior chamber of the eye. Okay. So if your patient is taking any types of these medications and they may feel a slight burning or stinging. And if your patient has any sulfa drug allergies, then they may have an allergy to this as well. So we always want to assess if our patient has an allergy to sulfa, we don't want to be giving them any type of carbonic anhydrase inhibitors. Okay. This medication can cause drowsiness, depression, and irritability. Right. So we need to watch them for the drowsiness, any possible mood changes, and then we're going to monitor those electrolytes as well. Okay. All right, so we covered, what is that, 5 types of medications that we would give for glaucoma? Let's see here. What question do I want to ask you? There's something that's common to a lot of these medications if we were to give them. What are some patient teaching things that we should say to our patients about most of these medications?
Avoid driving at nighttime.
Very good. Avoid driving at nighttime. Wonderful. What else? What else do we have? There's another one.
An expected side effect, like, maybe blurred vision and irritability, irritable, that the eye would be kind of irritated.
Yes, very good. Very good. All right. We want to check those vital signs on most of these. Right. We already said no night driving. Check the vital signs. Very good. Which medication should we be careful about using with any other eye medications? Do, 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 do. Alpha adrenergic agonist, right? Remember we said if your patient is taking a medication from that class, you need to wait 5 minutes before using any other eye medications for them. Okay.
I have a question.
Uh-huh.
For the one, let me see. Let me check. Let me see. 1 second. Sorry. For the alpha, yeah, there it is. Okay, so for the alpha adrenergic drugs. Okay, so are those the ones that I'm sorry. That would you have to, okay, so with any of these drugs, put it like that,
Mhm.
would you have to watch it like if they already take blood pressure medication?
Absolutely.
Okay, I just wanted to.
Yes, because if they're already taking those blood pressure meds, then we're already trying to lower their blood pressure. And in the event that some of these drops go systemically, then we may notice a drop in either the blood pressure, maybe a drop in their heart rate. So we absolutely need to monitor for those. It's a good question. Very good. Right, and then a lot of these meds also can cause photosensitivity, so be sure to tell your patient they may need to wear some sunglasses if they're going outside. Right? I do not know why rectal and vaginal medication is here in our eye and ear medication administration, but it's in here, so we're talking about it. All right, it must be something that you guys need to know, so I would know this. There's many medications that can be given vaginally or orally. And remember how to, or rectally, not orally, rectally. Make sure you know how to position your patient for each of those medications. So if your patient's getting a rectal medication, such as, let's see, diazepam can be given rectally, and that is to help with seizures. If your patient is having a seizure, at that moment, they can get, it's a medication called Diastat. They can get that rectally. You can give Tylenol rectally. I'm reaching here because Pediland, that's pretty much the only things that we give rectally. Oh, you can give suppository rectally, right? So if your patient is taking any rectal medications, please put them in the Sims position. If it's a baby or an infant, of course, you just grab their little legs and hold them up. But if it's an adult, it's going to be kind of hard to do that. It's going to be real hard to do that, actually. This is one of my clinical experiences when I was in nursing school, guys. Remember this because it was just that memorable. I was working with a nurse at the VA, and she was ready to retire. So she probably wasn't the best nurse that I could have been working with. And I was not a CNA before I became a nurse or before I went to nursing school. So I didn't know the ins and outs of anything. I didn't have kids. I don't know how to change a diaper. I don't know any of those things, right? So I'm in the room with this guy. My patient was probably 6'2" maybe. And I'm not 6'2" at all. And he probably weighed about, I'm gonna give him about 270. So there was a code brown. My patient had a code brown incident. And for those of you not already in the medical field in some capacity, the code brown is there's a lot of poop somewhere. So my patient had a code brown episode, and me, I gotta go change my patient. I'm excited. This is when nursing school is exciting. I gotta go change my patient. This is great. So I go in the room and I'm like, all right, I don't know how to do this. So I went to my nurse. Guess what she said? I said, I don't know how to change him. She said, you change him just like you change a baby. Yeah. I was like, I can't just lift his legs up. So I don't know. I don't know how that's going to work, ma'am. Anyways, if you're going to give a rectal medication to your patient, please put them in the Sims position. If you're giving a vaginal medication, make sure that they're either in lithotomy position or dorsal recumbent position. If you need a little refresher on those two positions, please refer to your, I think it's in your skills book, I think, or a picture in case you need a little refresher, okay?
I cut off. Can you repeat the two positions for the vaginal, please?
Lithotomy or dorsal recumbent.
Okay, thank you.
All right. Moving on to chapter 19, we're going to talk a little bit about over-the-counters, herbals, alternative drugs, and then we'll end up with vitamins and minerals. All right. A review. We all like over-the-counters, right? That just means we can walk in based on whatever our symptom is and pick what we need when we need it and use it without having to go to the doctor and then pay for a prescription. So common influences is your friends, you know, advertisements that you might see on the television or the interwebs or on your Facebook because you said on your Facebook post that you have a headache. So now BC powders, Goody powders, aspirin, Tylenol, all those things are popping up as ads on your screen, or is that just me? Anyways, so fun. Let's have a little fun discussion here. What wonder drugs have you seen on TV or read about? Well, I'm sure we're not reading newspapers or magazines anymore, but what wonder drugs have you seen that are, you know, over the counters or non-prescription?
Pepto.
Pepto? Wonder drug. What's the song? Nausea, diarrhea. Is that it? Is that one for Pepto?
Yeah.
Okay, very good. So
Zantac.
Zantac, okay, you can get, oh, whoa. Zantac, pull the brakes. I don't think it's on the counter no more, over the counter. They pulled it. I can't remember what happened, but it's no longer.
Tums.
Tums, absolutely. Or Alka-Seltzer. Let's see what we got. Claritin. What other like herbal meds have you guys seen?
Elderberry.
Elderberry. I swear by my elderberry, y'all. You can't tell me nothing. Elderberry is gold, is solid gold. Also, not to brag, but I just got an elderberry plant and it's not dead yet. Boom. I might have elderberries of my own in a couple of years. But anyways, so my other grandma, the one who passed away a few years ago, she used to be awake all hours of the night and she would watch TV. You know how the infomercials come on in the middle of the night and like they show you things that you need? Her thing, and she never tried it, thank goodness, but her thing, every time that Garcinia Cambogia commercial came on, she was glued to the TV. She's like, I need this medicine. It is good for everything, right? Like, it's supposed to keep your blood sugar in check, your cholesterol down. It's supposed to help with your appetite. She was like, I am going to get me some of this Garcinia Cambogia. I mean, she was all over it. Well, turns out it's probably not the best thing on the planet because it can cause some pretty bad liver injuries that could be severe and could kill you. So it's a good thing she never tried it, but she was always glued to the TV about it. So there's always kinds of these wonder drugs that you might see on TV or read. You know, back in the 90s, we had all the weight loss drugs, you know. I can't even think of the names of any of them, but they all had that one ingredient that's supposed to be really bad for you. Fen-phen, yes, fen-phen, phentermine, all those things that, you know, also could possibly not be so good for your heart and, you know, I mean, you'll lose weight, but I don't know if this is the way you wanted to lose weight. Anyways, so there's all kinds of things that are out there on the markets that we see. That's basically the whole point of that concept. Alternative meds. I mean, I think to some degree, a lot of us really subscribe to a lot of different alternative medicines, you know, herbal therapies, You know me and my aromatherapies. I got to have my aromatherapies. I have all the oils, all the oils. They all work for everything, right? Chiropractors, you know, trying to absorb some of this Eastern medicine practice into what we do normally. You know, if you go to the doctor and you say your blood pressure is too high, okay, well, maybe I'll start getting massages along with my blood pressure medicine, and maybe that'll kind of help my blood pressure go back to normal, you know, or maybe I'll start doing other things to help with my standard care. So if you're doing that, then you're using complementary medicine. That just means that you're still doing what we do here in the Western world, which is pop a pill, but we're adding something else to it. You know, I might do yoga, maybe some Tai Chi, rub some oil on my wrist to see if my blood pressure will go down some more, right? So that's more of complementary medicine. Okay. Why would there be some sort of medical concern that's related to the use of the herbs or the supplements or some of these homeopathic therapies?
They could be contraindicated with their regular meds.
Absolutely. They could definitely be contraindication or contraindicated for the meds that you're already taking. Very good. Like the one that I looked up for Miss Castillo yesterday. Brillia, is that what it's called? Right? Maybe there's not enough studies done on the particular herb that you're trying to take. You know, maybe it's not been found that it's safe in a population of people. So if you're looking for something to take for an 80-year-old woman, maybe there haven't been enough studies shown for it to say if it's safe, if it's efficient, or if it shouldn't be taken at all. So, I mean, there's that real medical concern. And so when you're dealing with your patients and you're finding out what medications they're taking, always ask them, are you taking any herbal medications or any supplements? Okay. Anything over the counter that you're taking, because we need to know, especially based on what other medications they're taking.
Some herbal remedies or medications or dietary choices increase the effectiveness or decrease the effectiveness of medications like onions.
Absolutely.
Too much onions causes heart palpitations, or garlic or saw pimento.
So, absolutely. So you always have to be careful with those medications and, you know, the foods that you're eating, you know, they can all interact with those medications that you actually are taking. They can either enhance the effect of them, which means that your body could become toxic from those medications, or it can decrease those effects, right? Very good, Miss Ralph, very good. So any concerns about those herbal products and dietary supplements that we might see? You know, we love them, especially if we really are more interested in earth things. Usually they're more pure than any of those meds that have been created in a lab, right? We think they're safer, you know, if we haven't done the right research on the medication before we start to take it. And we think they're pretty effective. You know, there's lots of blogs nowadays. I personally would prefer, if I'm thinking about taking a medication, I would prefer to do the research, find some scientific scholarly journals that can tell me, all right, this is safe or this is not safe for whatever you're trying to use it for. One of my daughter's first nanny, she was very homeopathic, and she used Golden Seal for instead of antibiotics for her kids when they were growing up, right? So, you know, I never looked into it because, I mean, I just never looked into it. I'm sure it works. And then I had said that to someone and they're like, oh, you mean the Golden Seal that you take if you don't want the weed to come out in your urine before a drug test? I know, listen, I know. I said, no, that's not what I meant. And no, why we got to go there? I was talking about antibiotic properties. Anyways, so know that different things are for different things, or some things are the same, they're from different, I don't know. People do what they want to do, I guess. Anyways, so we just feel like they're safer for us because they're not created in a lab. And we figure, if it's growing up out of the ground, that means that people long before me have used it because it's grown up out of the ground and it's been around for a long time. I'm on the fence there. I think that there's lots of good things that grow up out of the ground for us, but I also think that the good Lord wouldn't have made scientists and research unnecessarily. So I'll take my pill, but I'm also going to use my oils or do whatever, needs to be done. Anywho's, natural estrogens, we'll talk about this more. And when we talk about menopause, I think it's either growth and development, it may be in geriatrics also. You'll learn flaxseed, black cohosh, yams. Those are all great and provide lots of natural estrogen, and they help a whole lot with menopause and all things lady. So a lot of ladies, especially when they're going through the change, will look for these, something to help with the side effects, whatever they're going through when they're going through menopause. I've heard great things about black cohosh, but it's got a lot of side effects as well, and it can't be taken with a lot of medications. So, you just, as long as you're doing your research and you tell your patient to do their research as well, discuss with their physician, what they're taking. That's one of the downsides of taking these herbal products and dietary supplements is sometimes these things haven't been tried and true. So you really don't know when to take it. How much can you take? Should I take 7 pills today or I'm gonna just take 4 pills tomorrow? I don't know. So some of those things aren't really studied, tried and true. So can you guys think of any herbal remedies that might be used to treat conditions that usually require prescriptions? I got my pen and paper. I'm ready. Let me write this down.
Cranberry juice.
For the UTI?
Yep.
I'm
trying to think of the ones Dr. Ross said in her.
The elderberry?
Elderberry? I mean, elderberry usually is taken more for prevention and not really to treat something.
I took
Also,
raspberry tea for fertility.
Really?
Mhm.
Does it work?
Yes, I got pregnant with my last one, with Evelyn.
Very good.
Lord. Let me keep the raspberries away from Brianna.
I still have some if y'all want some.
She said no more
They use
raspberry tea.
tea to go into labor too.
Yes,
raspberry tea for
so
labor.
you take it only up until you get pregnant, right? And then once you get pregnant, don't take it again because then it can induce labor.
Like jasmine.
Also cumin.
Jasmine
And
can
make
induce
a
labor.
tea out of cumin, and that helps you go into labor as well.
Huh.
Pineapple and papaya helps you go into labor.
Oh,
Pineapple is also good to help you with a cough.
wow. Oh, yeah.
The bromelain in pineapple is what some of these cough syrups try to mimic. But if you're not allergic to the pineapple like myself, then you can eat the pineapple. It'll help you with the cough. And
Yeah, I
honey.
don't know why lately pineapple like cuts up my tongue. That never happened before.
Honestly, I think it's more the what do you call it?
If it's
Pesticides.
fresh pineapple, eating too much of it can cause you to feel like you have cuts all over your tongue.
Yeah. Yeah.
That's so true, best friend.
Very good. Right. Any other? I use if I'm starting to get a sinus infection, I will put my diffuser with some eucalyptus, some rosemary, some lavender, and some tea tree, and diffuse it overnight, and I wake up a whole new person. It's fantastic.
Good
So there's all kinds of things, tried and true. I think Grandma said when she was younger, if any of them got the mumps, they had to rub, oh gosh, what is it? I think it's sardine oil all over their face. That was their I know. It was just nasty, right? Can you imagine being in the house? There was 9 of them.
Oh my God.
Had to rub the sardine oil on their faces for the mumps. So that was their remedy.
Oh, wow.
Right?
But it's a virus, right? It'll just play its course like.
It will. I mean, it's very uncomfortable. That's why we have the vaccine nowadays. But, back then,
Yeah.
Very good. All right, some of these types of herbs that you'll see most likely from when you're in the setting, if you're in a hospital or clinic, these are some of the most commonly seen herbal meds that you'll see. So you'll see chamomile. Obviously, if I'm feeling a little nervous, a little anxious, chamomile tea is fantastic for that. It's very good to help you relax. So at nighttime, you can have a little cup of tea, put some chamomile in it. Echinacea is great for colds. It's great for wound healing and infections, right? Feverfew, I haven't had a whole lot of people use feverfew, but it's good for fevers, migraines, arthritis, ulcers. Lavender, if you get organic lavender, I make lavender lemonade and it is great for migraines as well. So that's just a tip from me, just because I can attest to that one. Flaxseed, if your patients are constipated and they don't want to be taking Miralax or Colace or any of those other medications, they can add a little bit of flaxseed to their diet. Right? Garlic is great. Those recipes that call for 1 to 2 cloves of garlic, I think they're garbage. I always have to add like 8 or 9.
But can garlic be a blood thinner?
It can.
Yeah.
It can. But still, when I'm cooking, you just can't have enough sometimes.
I know it's good.
It's fantastic. But it can be good for
I'm sorry. You were saying it could be good for what?
blood thinning.
Yeah,
So
when I was extremely overweight, I used to take garlic and ACV
Mm-hmm.
in a bottle of water
Uh-huh.
to lower my blood pressure.
Mm-hmm. Did it work for you?
Wow.
Yeah, absolutely.
Yes.
How'd you lose the weight? Like that?
Say it again.
Oh, did it help lose weight or no?
No, weight loss surgery helped that, but it helped me helped me from having to be on medication and things like that. Like I would have edema when my blood pressure would be up. So I would always know, or swelling in my hands or something like that. So I would always take that to, flush it out of my system or whatever.
Very good.
Yeah.
Very good. So I know they sell the garlic, the tablets or pills over the counter. You can get those. Ginger is fantastic for nausea and motion sickness. It's very good for that. Right? Ginkgo biloba is great for memory. It is wonderful for memory. I had the funniest thing happen when I was working in a clinic. I had a patient and I asked her what medication she's taking at home. And she writes off, almost all of her meds, like, the ones that she's prescribed. She's like, oh, I'm taking this for my cholesterol, I'm taking this, blah, blah, blah. And then I'm taking that one medication, it's over the counter, and you use it for memory. She couldn't remember what it was. I always thought it was very funny and ironic. That she was taking it for memory, she couldn't remember what it was.
Oh, man.
But the ginkgo biloba is great for your memory, also good for asthma, bronchitis. All of these medications, your prescribed medications will come with some sort of contraindication if you're not to take these meds. Like St. John's wort is great for depression, but you can't take it when you take certain other antidepressant medications, right? So you always need to know what your patient's taking, even if it's not prescribed.
Miss Duhan.
Uh-huh.
What do you think would be good for anxiety that's a natural remedy?
Well, this top one says chamomile. I mean, I'd have to research because I don't really.
But out of your own experience, you don't know.
I have a lot of them.
I don't really get too anxious, so I don't. I mean, I'm kind of
Well,
more.
I don't mean personal experience. I just mean experience as in of or.
Oh no, I haven't.
Wort, St. John's wort. What else? And that's really known. Ashwagandha. What else?
Well, I recommended something yesterday.
What was it?
Yes, you did. Hush your mouth. It's not legal.
I'm trying to think.
It's not legal.
Is that a married person's thing? Oh, no, she's talking about something else.
You talking
Boy,
about-
here goes Bree again.
We're
Hush,
not talking
Brianna,
about the
hush.
weed. It's not legal.
A stick of weed.
I give my daughter lion's mane for
Part
nervous.
of it.
What was that, Miss Ralph?
Well, Lovely was talking.
Oh,
I said technically, if you have a medical card, it is very legal.
well, I mean, that's true technically, but I don't think that Miss Guerra was talking about the medical card that you have. I think she just want to go to the backyard and,
Okay, so
Brianna,
CBD
And-
may be very helpful.
professionalism, Miss Guerra, professionalism, please.
CBD may help. Very good, Miss Brockers. That may very well help with any anxiety. It's worth a try. Always.
And I was saying that, ooh, go ahead.
Go ahead. No, you go ahead.
No, you go ahead, because I wasn't talking about her anxiety.
Oh, I was just saying, just if you're going to use the CBD, make sure you get it from a reputable source.
There was a nurse that I knew in Fort Worth that she would order it online. And she's an RN, and she was taking it on a daily basis, and she said it was working wonders for her.
Just know your source. Be sure you know where you're getting it from. Make sure that it's a reputable site that if you're going to order it, but it's good for everything. I mean, it's worth a try.
I use lion mane for my daughter's neuropathy. So,
Lion's mane,
mhm.
is it a tablet or liquid or what?
It can be both. For her, I use the liquid solution, but my sister uses the tablet. My sister has MS, and my daughter has auditory neuropathy. And lion's mane repairs nerves, and it helps with memory.
Oh, repairs nerves. I'm gonna write that down. Thank you. We learned something new.
where
every
do you
day.
find it, Nakia? I'm sorry.
So they sell it inside of like World Marketing. I was about to say a bad word. World Marketing, stuff like that. But you can also get it on Amazon. You just have to make sure that it's verified. Because some places they'll give you, it's like a watered down version of it. That's one reason why I don't use the capsules. I'll use the liquid suspension. And
it's called Lion.
for lion's mane, like a lion, like a raw lion, not like you
Yeah.
lions. It makes you poop, or it makes the babies poop. It makes the kids poop. It makes elderly people poop too, because when we had our grandfather, he wasn't on any medications. He had Alzheimer's, but we did give him the lion's mane, and 22 drops for children is acceptable. 45 drops for adults is acceptable. And we would give him about between 25 to 45, and his poops was something to be reckoned with.
So it'll help clean you out when you take it. Maybe that's the lion part. Maybe that's the roar.
Probably.
Well, I can use that to lose weight, Nakia.
You probably could, but it'll help more with remembering not to eat nothing.
Or how about, I think it might be good to try it. So does it work with like pain? Like it helps you with like muscle pain and stuff?
So we use other things for pain. Blue lotus, it's a herb, it's a flower, for anxiety, for pain, for like bad dreams, lucid dreams. Some people have night terrors and things like that. We'll use blue lotus. And if you do smoke weed, if you put the blue lotus with the weed, it'll intensify the high.
But we don't need to know that.
Well, some people do use it for herbal, reasons. It's good to know, especially as a nurse, you'll need to know, because some of your
This is true.
patients won't want to tell you that. So you need to know what they're using.
This is true.
Can,
Lotus
the
is
Blue Lotus,
also
can you
good.
use that for children? Or
You
teenagers?
can use it for children. Yeah, you can use it for children, but I wouldn't use it in teenagers because it does, it increases like the sexual drive.
Oh no.
So yeah, I wouldn't use it in children, but you can use, what is it? There's something that you can use different that's in children. I
Can
can't
you buy
think of
those
it.
where?
I get all of my stuff online, if not at a herbal like spot. I mean, for like certain plants, I'll go to like a reputable place that has plants. But for the most part, you can get everything online. That type
Yeah, I
of
was
age.
looking for something for anxiety for like a teenager, something like that.
My kids don't have anxiety, so I can't even,
Yeah.
I say call on God for that. I don't know. I'm sorry.
Call them.
Got it. Hold on, God.
Do a little bit of research on the interwebs. I'm sure you'll be able to find something, just, like I said, just make sure it's a reputable source. Both if you go to buy and when you're using the information for looking that up.
Or go get them some crystals.
Yes, get them some crystals.
Go get them some crystals, have them meditate. When Nyla has, she doesn't have anxiety, but she gets frustrated, I just have her meditate. It's easier so you don't have to beat them. So.
Right. And I don't want to put her on medication.
And if they get sick, we give them golden milk, and that's pretty much like turmeric, black pepper, and they use goat's milk for the most part. But since they're older, we use almond milk. Initially, we used to use goat milk because it's the closest thing to breast milk.
Right.
And we don't drink cow's milk in my house, so we used to use goat's milk, but now we use almond milk. But it's the same essential thing. And it helps them from getting sick. Like every year, around this time when everybody gets sick and nasty, we just give them the golden milk. And then if like they have skin inflammation, we do turmeric and things like that with their foods.
Turmeric is a wonder. It is a wonder. It will stain your clothes and everything, your hands, if you're, using it for beauty purposes. So you have to be very careful. It is staining, and it's a lovely bronzy yellow golden kind of color, so be careful if you're using it. So now we have our guru. Y'all have questions, please refer them to the guru.
I was about to say, let me talk to Nikki.
You talk to the guru. Let's take a break, guys, before we get into the vitamins and minerals. Let's take a break, come back at 1:44. That's 1:45. All right, everybody back. Type your name into the chat for me, please. We'll do a little recap before we go forward. All right. Recapping, let's talk about, somebody give me the 3 names of some drugs that I told you for the prostaglandin agonist. Anyone? 3 drugs that,
I'm sorry.
oh, go ahead, go ahead.
You were asking for 2 prostaglandin agonists?
Yeah, give me the 3 drugs I gave you.
Oh, that you gave me. I was in the book. Sorry about that. Hold on.
It's bimatoprost, latanoprost, and travoprost.
Very good, very good.
Yeah, all of them.
All right. What was one of the things we said about these medications?
They can change your eye color.
It can change your eye color and tell you ladies what when they're taking this medicine.
It might grow
Don't
your
take it to grow your eyelashes.
There you go. If you're taking it in one eye, do not use it in the unaffected eye because you think it's making your eyelashes grow more. All right. Do not do that. Okay. Okay, so we said this one is going to help relax those eye blood vessels.
Where can I get some of that?
No, you can wait. I can't even point to the door right now because you're not near my door. But just know I'm pointing to a door.
I got kicked out a couple times yesterday.
You did. You did.
Oh my God.
Okay, somebody tell me the 3 beta-adrenergic antagonists that I told you. It's on the next few pages over.
the
Paxolol, timolol, levobunolol.
Very good. All the LOLs, right? You see the LOLs and we're talking about ophthalmic drops or medications, then the beta-adrenergic ones are going to be the LOLs, okay? Remember, these meds help to reduce the amount of the aqueous humor that's produced from the ciliary body of the eye. Right? Remember, we want to make sure that we're holding that nasolacrimal duct for these because we don't want it to go systemic because these can also drop your heart rate and blood pressure. Okay, and these are the medications that can mask those symptoms of hypoglycemia, so always check your blood sugar on your diabetical patients. All right. I gave you 1 drug for the alpha adrenergic agonist.
Apraclonidine.
Very good. Very good. All right. This one, we said it reduces the amount of aqueous humor that's produced in the eye. And we want to watch out for bradycardia and tachycardia for our patients that are taking this. Okay. These meds will, blurred vision, very good. Don't rub your eye when you're taking this medication, even though it feels like dirt. And please wait 5 minutes before you use it in any other eye med. What about the cholinergic drugs?
Carbachol and pilocarpine.
Very good. And what do we know about the pilocarpine?
causes diarrhea.
It could cause diarrhea. I remember this one because, you know, and I'm not telling you this if you want to, I'm not telling you this for any other reason than just to help you remember. But if you put Visine in somebody's drink, it will give them diarrhea.
Oh yeah,
Don't
yeah.
go try
that.
I'm not telling you to go prank your husband or your kids. I'm telling you just to help you remember. So, all right. And these cholinergic drugs will help to decrease that intraocular pressure by reducing the amount of the aqueous humor and improving the flow.
Yeah.
Right. Very good. Let's see here. What do we report if we think our patient's having some sort of drug toxicity with the cholinergic drugs?
Drooling,
Very good.
sweating.
Drooling, sweating, right? With those cholinergic drugs, that's what we're looking out for. Is it could produce excessive, what's the word I'm looking for? Not moisture, excessive water resubstance from the body. All right.
That was cholinergic.
Uh-huh. Mhm. And with the final one, the carbonic anhydrase inhibitors, we want to be sure that we are monitoring their electrolytes and watching them for any drowsiness and mood changes. What allergy, an allergy to what drug will make your patient not take this medication? If your patient is allergic to what class of medications, should they not take carbonic anhydrase inhibitors?
Sulfa drugs.
Very good. Sulfa drugs.
Sulfa, yes. Patients allergic to any sulfa drugs.
Very good. All right. Moving right along.
Like burning and stinging is a reaction, right? Allergic reaction
Mhm.
to sulfa drugs.
Very good. Somebody tell me, what is an alternative medicine?
Oh,
A medication not prescribed by a doctor?
Yeah, or not necessarily even a medication. It's some sort of therapy that does not include our typical Western medication. So, Western medication. So more like herbal therapies, aromatherapies, chiropractor, acupuncture, things that we do outside of medicine, right? I have back pain a lot of times, so I don't want to take medication all the time. So I'm going to go get a massage, right? So I don't want to take that normal medication that we have. And what about complementary medicine? What is that? It's not free. Not like, the complimentary meal that you have at the hotels. It is when you're using those alternative therapies along with your medication that's been prescribed. So you're blending both the Eastern and Western cultures together, and you're using your, blood pressure pills along with acupressure or something like that. Okay. Okie dokie.
Basically, anything that's not pharmaceutical.
No, for complementary medications, you're using, or complementary therapy, you're using those pharmaceuticals along with something else, because basically they help each other. They complement each other. Like, not complement like, oh, hydrochlorothiazide, you are so pretty. But more like it might help the effect of that medication, right? All right. Let's move on to the vitamins. I'm going to share my screen. All right. I said from current slide. Here we go. All right, so vitamins. These are those chemical things that are naturally found in plant and animal tissues, but most of them are not made in the human body, right? Anybody know which vitamins are fat soluble?
Is it vitamin E?
Isn't it the DAKE vitamins, DAKE?
Like fish oil?
No, that's not a vitamin.
So it's vitamin D, A, K, and E, right?
Yes. Yes.
Yeah. See, that's what I meant.
Ma'am. Yes, those fat soluble vitamins are, however you remember it the best is how you say it. I know I heard Ms. Johnson say she had one way she said it, and I heard Ms. Ralph say it another way too. I'm difficult, and I find in not a word. ADEP is for me. ADENK are your fat solubles, and you'll learn this with nutrition. So it's not necessarily something that I want to focus on right now because you're going to learn it next semester for sure. Then all the other vitamins are water soluble, like vitamin C, vitamin B, all those others are water soluble. Okay. If you eat healthy, right, you eat all of the rainbow of foods every day, then all these necessary vitamins that you need are going to be obtained from that diet alone. You shouldn't need any extra supplementation. So, you know, if we weren't all so busy all the time and having to stop down to the McDonald's or have everybody else cook our food all the time, or, you know, if we didn't cook, you know, some of these vitamins in the foods that we eat can be, what's the word? We can disrupt the way that they're supposed to help us by overcooking them. So, you know, if you know, for Thanksgiving, let's take Thanksgiving, for instance, because that's when all the food has to taste good. You know, we don't necessarily care about nutrients at Thanksgiving. We want it to taste good. So, you know, you boil or you cook your green beans until they're no longer like a bright, vibrant green. Or is that just me? That's just the South Carolina in me, I guess. Okie dokie. Well, we boil them until it's not even bright green anymore. So that means to me that not all, but a lot of the nutrients that were in the nice, fresh, vibrant green bean is now lost to the cooking process. So
it should be al dente.
Listen, for Thanksgiving, it's not al dente. It should be heavily cooked and soggy, full of salt. For Thanksgiving, just Thanksgiving, not all the time now. Thanksgiving.
I hate soggy vegetables.
Any other time, I do make them al dente. I like them crunchy. But for Thanksgiving, it has to be overly salted and no longer nutritious. Okay, that's just me. All right, so let's start with vitamin A. All right, so this is one of those fat soluble vitamins. I think we talked about this in, I don't even know what other class we talked about it, but I remember discussing it with you guys before. But this is great for visual adjustment. So this is great for the eyes and great for cell membrane stabilization. Think me, skills, very good, right? Since it is a fat soluble vitamin, and remember all of your fat soluble vitamins are absorbed in the intestines, right? Right. If you have a patient who has cystic fibrosis, if they have chronic diarrhea, your breastfeeding mothers and infants, those can all be at an increased risk for vitamin A deficiency. So you may see lab work being taken from those individuals more frequently because they're monitoring and making sure that they have enough vitamin A in their system, right? So we use vitamin A to treat those deficiencies if they have them. Any eye diseases, night blindness. It's also really good for your skin. So there's lots of preparations of vitamin A that is particularly only for your skin. If it is used for your skin, I think I told you guys one of the examples I had was for Accutane. Retin-A is another one. Those are great for your skin, especially if you're prone to a lot of acne, but you just can't be pregnant when you're taking them. And you can't take any other vitamin A's, any other vitamin supplements of vitamin A if you're taking those meds, right? If you have a patient who is taking vitamin A, you want to be careful because we don't want them to get, hypervitaminosis, which is when your patient has too much of the vitamin A in their system, which if they have too much vitamin A in their system, then they can have some visual problems, and you'll notice some changes in their skin, and they may have some bone pain as well. So if your patient has that, that's what we're looking out for if they're taking too much vitamin A, right? If your patient is taking oral
visual problems. And what else?
I don't know. What did I say? Changes in the skin and maybe some bone pain. All right. If your patient is taking oral contraceptives, you want to be sure if they're taking vitamin A, because that could interact with the effectiveness of that medication. Okay. For either oral contraceptives or the anti-hyperlipidemic drugs. I don't know a whole lot of people that are still taking mineral oil at this point in time, so I'm not even going to mention it right now. But for the oral contraceptives and the anti-hyperlipidemics, it can interact with the effectiveness of that medication. So you want to make sure. I know a lot of ladies will take prenatal vitamins even when they're not in the prenatal way. They just want that extra vitamin. I took them for a long time because they're great vitamins. They really are. But if I was going to take oral contraceptives or anti-hyperlipidemic drugs, then I would have to be very careful with that extra vitamin A. Okay. Any nursing implications? We can give vitamin A, typically given orally. Okay. We don't typically inject this or put it in IVs or give IM or sub-Q. We don't usually do injections of it. It's typically orally, given orally. Lifespan requirements, I'm not requiring you to know how much a kid needs because we're not in pediatrics right now. But for a daily requirement for adult men, it's 900 micrograms. And for women, it's 700 micrograms. All right. So if you're going to be the nurse here, some patient teaching that you would need to know for your patient if they're not wanting to take supplements, what would you tell them to eat that is a good source of vitamin A?
Spinach,
Broccoli.
Broccoli.
kale.
Who?
Doesn't kale have vitamin A also?
It does.
Yeah.
So some of those green leafies. Cantaloupe, carrots, squash, like your orange and yellow veggies. Liver, everybody's favorite. It's delicious. So good. And some dairy products, all right? If I'm willing to bet my life here, I'd say if you really want to get a good dose of vitamin A, stick to those orange and yellow veggies. You know, those yellow bell peppers, the squash, the cantaloupe, carrots. These are great sources. Right. Next, we'll talk about folic acid or vitamin B9. This is one of the water solubles, and it is required for normal erythropoiesis, which is what?
Produces red blood cells.
Very good. Very good. All right. So this is metabolized in the liver, and then it's changed to an active form from there. Right. So most of us should already know, because I know a lot of us have the children. We use folic acid as very important pre-pregnancy, right? Why is it so important before you decide to get pregnant?
For fetal growth?
You're in the ballpark.
Brain development?
You're still in the ballpark.
Oh, well.
Is it CNS development or spinal or something?
Spinal, yes. You want to prevent spina bifida, which is where there's an opening where the spine is. So usually your patients with spina bifida will have a little tuck to hair or a dimple where it doesn't completely close, where that opening doesn't completely close. And so we have found that about at least 400 micrograms of folic acid pre-pregnancy will help to prevent that from happening. All right. So it will help prevent those neural tube defects, is what we call spina bifida, is a type of neural tube defect. Right. We also use it to treat anemias. We treat alcoholism with the folic acid. It's added to formula. If mom is lactating, then we might want to give her some extra folic acid. But you're going to hear folic acid most when it refers to pregnancy. Oh, where'd my mouse go? Here it is. It is not toxic, so you should not have any what do I want to say? It's not like vitamin A that can build up so much to give you those problems of the bone pain and whatever else I told you. Vision changes and things like that, right? But if you're allergic to folic acid, you might have bronchospasm, you might have some flushing, some erythema, you might get real tired and malaise, or you might have pruritus or a rash. So if you're allergic to folic acid, then you're going to manifest as an allergy. Okay. Drug interactions. If you're taking this first medication, first of all, you shouldn't be taking it. It is no longer available, at least in the oral form in the United States. So anytime you see this chloramphenicol, that is no longer a thing here. So don't worry about that. But methotrexate, this is a medication that we use a couple of different ways. You'll notice some people with rheumatoid arthritis will have infusions of methotrexate. They're relatively lower dosed. Also, methotrexate in high doses is used for cancer. It is one of the chemotherapeutic drugs in high doses that we use. So if your patient has cancer and they're taking methotrexate, they cannot take folic acid because it will interfere with the anti-cancer effects. But if they're taking the methotrexate for rheumatoid arthritis, it's in such a lower dose that it actually helps with the side effects. It helps to reduce the side effects of the methotrexate if they're taking it for rheumatoid arthritis. So, careful with that. Also, if your patient is taking anticonvulsants, somebody name an anticonvulsant for me.
Phenytoin.
Phenobarbital.
Very good. Phenobarbital, phenytoin, very good. Carbamazepine, any of those medications, folic acid can alter those, the anticonvulsants can alter the folate levels. So your patient may need to have their labs drawn a little more often, or they may need to have folic acid added to their diet or a supplement with it, because those medications can decrease your folate levels. All right.
Okay, I have a question. Is folate and folic acid the same thing?
Yes.
Okay.
Yes.
I heard you saying folate, but I've always wondered that. Okay, thank you.
Folate, folic acid, vitamin B9, it's all the same. All right. High doses of folic acid, if your patient is taking high doses, it could alter the color of your patient's urine. It can make it brighter. It can make it a darker yellow, but super bright. So let your patient know that it can alter the color of urine if they're taking high doses. All right. I don't know who's going to be taking it in high doses, but if your patient is, then let them know that that could happen. Any nursing implications that you may need to know. If your patient is taking this in a parenteral form, it should be protected from light. This is like most of your vitamins. They come in dark bottles. Okay, you ever noticed? All of your vitamins, they don't come in, a see-through container. If it's liquid, it's typically in a dark brown or a dark blue container. They need to be protected from light. Okay. So if they're not protected from light, then they may, the vitamin itself may not be as effective. So, right. Make sure you teach your family, your patients, all right? Make sure that you are getting that folate or folic acid in your diet. What's the best way we could do it?
Fresh vegetables.
Fresh veggies, what's another way? Come on. Drinking some orange juice. Drinking some orange juice is a great way, especially it's a great, easy way to get that folic acid up in your body. Okay. Lab monitoring. So if someone needs to, be sure that their folic acid is not decreasing and that it's increasing enough when they're taking the medication, we need to follow their labs and make sure that they're following up. Just because you start taking folic acid or any vitamin doesn't necessarily mean that we fix the problem. All right. You may need more or less of that vitamin. All right. Vitamin B12. another water soluble vitamin. This vitamin is great. I was told when I first started nursing school, if you need a little extra energy, get you a complex B vitamin. It is great. But these function in fat and protein and carb metabolism. Right? And this is required for DNA synthesis. So you need it in your body. Okay. This will treat all those B12 deficiencies, any of that pernicious anemia. So your patients that have had any type of gastric surgeries, they tend to be deficient in the vitamin B12. So they will always be taking vitamin B12. Okay. We typically give it IM, and it is red in color. All right. It looks like those, those little pens that you see at the nursing stores, little ink pens that look like they're what's the word I'm looking for? They look like they're syringes, and they have the red. That's what the B12 looks like.
And it also burns when you're getting it injected.
Oh, tell your patient. Tell your patient. I've never had it before, so I cannot attest to. All right. If your patient is taking vitamin B12, colchicine, metformin, some of the potassium drugs, and some antibiotics can decrease the absorption of B12. So if you have a patient who's taking B12 or who needs B12 and they're taking any of those medications, then they're probably going to be monitored a little bit more, because we want to make sure that those meds are not decreasing the effects of the B12 that they're taking. Okay.
What are the meds again?
Colchicine, metformin, some potassium drugs, and some of the antibiotics. Not too specific, because it's not necessarily need to know. You just need to know that those drugs can alter the absorption of B12. Right? If your patient is deficient with B12, you will notice them having pale yellow skin. They might have some mouth ulcers. They might have some disturbed vision. They could be irritable, depressed. And they can have gait problems, problems with walking, or paresthesia. Might feel like, in their extremities, they may feel like they're on pins and needles. Those are things that can happen if your patient is deficient in B12. Okay. All right. Allergies to this medication are rare, or if they have an allergy, then they may have pruritus, or they may be swelling. They may have a severe anaphylactic reaction. So it's typically not anything, but if they do, then they may have the big one, the anaphylactic reaction. Right? Alcohol, I already said colchicine. Those will also lower the absorption of B12. All right. If you have been deficient in B12 for longer than 3 months, you could end up having some irreparable neurological damage. So that pins and needle feeling that you had maybe every now and again when you first realized that your B12 was not, the levels weren't sufficient, that could continue. Right? You could have permanent feeling of paresthesia, or you could have permanent gait problems because of this. So it's pretty important. We want to make sure that our patients are taken care of with that. All right. Vitamin C.
Johan, can you say that word for me one more time? When
Which
you
one?
said they feel like they're stepping on needles?
Oh, paresthesia.
Paresthesia. Okay.
Here, I'll put it in the chat for you. All right. Vitamin C. Vitamin C is great. We all love vitamin C, right? It acts in several enzyme systems. This is great for helping with that folic acid, right? It helps with the absorption of calcium and iron. So, if your patient's taking iron, we often tell them to take their iron with orange juice because it'll help the absorption of it. This protects your vitamins A and E. It's necessary for formation of teeth, connective tissue, and capillaries. So this is why, ladies, if you're going to have the babies, drink your orange juice, right? It's going to help your babies when they're forming the teeth, I guess, in the long run, not in the womb, although there are some babies that are born with teeth and it's kind of creepy, right? They're not real teeth.
Yeah,
They
like
don't
my
function.
child.
They don't function, but
My child was born with a tooth.
it's a little creepy, baby just came out. It's already creepy nowadays to me anyway, because babies used to be born and they keep their eyes closed and act like babies for a long time. And now they come out like, what you want? How you doing? It's hot out here. It's cold out here. They look at you sideways on day 2. So I'm just saying, when they come out with a tooth, that just picks it up a little bit.
That girl was ready to go to work.
That's right. Put her to work. She needs a job. She needs a job. It's expensive.
Yeah.
Right. So vitamin C, like we said, is water soluble. The best way to get your vitamin C is to eat it raw and consume it fresh. It is easily destroyed by exposure to air, heat, and light. All right. So you'll notice when you get your vitamin C tablets from GNC or Walmart or wherever you get it, it's in a nice thick opaque bottle. Right. You should store it, somewhere where it's not going to be exposed to light or air or heat. What foods are rich in vitamin C?
Strawberries.
Strawberries, oranges,
Orange.
limes, any of those
Anything citrus fruit?
Citrusy.
Any citrusy, tomatoes. Potatoes. Okay, those are all great sources of vitamin C. There has been some studies shown in, I don't know if this will, if you have patients who are septic, which means that the infection that they had has gone into their bloodstream and it's all over their body, it's circulating everywhere. There have been some promising studies shown with the use of high doses of vitamin C to treat sepsis. So that's always promising, because typically when you become septic, it's usually not a great outcome for you. But I know a few years ago, one of the doctors had actually tried it. He's like, I'm just going to try it. I mean, what else can hurt? This patient's already septic. So I'll just try this high dose of vitamin C and see what happens. And that patient ended up living and being okay. So that's just FYI. It's not, needed for a test or anything. It's just because. Right. Vitamin C, your patient might have brief soreness at the injection site. They may feel dizzy if it's given too rapidly. So you want to make sure you kind of give it a little bit slow. This will increase the effect of salicylates. So if your patient's taking a lot of aspirin or something like that, aspirin is a blood thinner, and this vitamin C could increase the effect of it. Right? Not compatible with potassium penicillin G, so don't give them together. And it can be given orally or parenterally. Okay. How many more of these meds do we have? I gotta gauge my time here because I want to give you guys enough time to take this little assessment as well. So we'll go through a little quicker on the remaining ones. All right. Vitamin D. This is one of your fat soluble vitamins like we talked about. It helps to move that calcium and phosphorus ions into the small intestines and kidney and the bone. We use this if we're treating childhood rickets, which is where in kiddos, they have soft, weak bones. You'll notice they have the bowed legs. They may have a big old forehead. They're not going to grow. So you might have a 5-year-old that looks like a 2-year-old. We don't see rickets much here in the United States because we have programs like WIC that make sure that children get a nutritious meal, allegedly. And that's what it's supposed to be for anyways. So we typically won't see that in the United States, typically, right? If your patient is taking thiazide diuretics and they're taking vitamin D as well, they could get hypercalcemia. Okay, so they may end up with too much calcium in their blood, and that will manifest as nausea and vomiting. They may have frequent urination. They may have bone pain because the calcium they need is no longer in the bone, but in the blood. And they might have some kidney problems. Remember, if you have a diet that's high in, you know, calcium and things like that, you are more prone to getting calcium stones or, you know, kidney stones. Right? So be very careful if your patient is taking those thiazide diuretics. Okay. How can you get vitamin D if you don't want to take the vitamin? What is one way you can do when you can get it?
The sun.
The sun, right? When your skin's exposed to the sunlight, vitamin D is made.
Yes.
Milk.
Milk. As long as your milk is fortified with vitamin D, right? But yes, if you go outside, you know, that's why, you know, take the baby outside for a stroll on a nice warm day. Go stand outside for a little bit, you know, it'll increase your vitamin D. Not enough probably for your whole entire body to use it, but it'll get you some. Okay. Vitamin E. Ladies, we love the vitamin E because it's great for our skin, right? It's wonderful for your skin and your hair and all the things. So we put it in everything. Okay, this is another fat soluble vitamin. It is important for vision. It's great for reproductive health. It's great for your skin, like I said, right? It has also been said that the high intake of vitamin E, as tocopherol, will help with Alzheimer's, but that's still studies being done on it. So I wouldn't just start popping.
Oh, I'm sorry. Vitamin E helps with red blood cells or people who are anemic, or it thins it. Am I?
Huh? Did I say that?
No, that's not right.
Did I say it?
No. I've heard before, or I read somewhere before that it helps with red blood cells.
It helps to stabilize the red blood cell wall. It'll help protect you against destruction of the red blood cell.
Oh, hemolysis.
But it's not for not for production.
Okay.
Right. Where can we get vitamin E in our diet?
Is it fish?
It's not on my list, but I'm sure you can get it from fish because the oils and things in the skin of the fish and in the fish itself. But sunflower oil, sunflower seeds, all your nuts, almonds, peanut butter, peanuts, your green leafies like collard greens, spinach. Of course, once again, the collard greens that you cook for Thanksgiving are not going to be the ones that are going to give you the vitamin E, okay? But if you take your spinach, I've eaten raw collards before. I didn't hate it. I grow them in my garden, and if you take them and cut them up real thin and mix it in with your salad, it's actually pretty good. You get some good vitamin E that way.
Yeah, or blend it with some.
Or blend it.
Yeah, berries and stuff.
With kale and spinach and all the things. Very good. All right. High doses will increase the risk of mortality. So we're not going to be taking vitamin E in high doses. All right. And that's all I got for vitamin E. Next one, vitamin K. Is this the same thing as potassium? No. What's the difference?
No. Potassium that's just the number for the periodic on the periodic table. Okay.
Potassium is a mineral.
Yes.
That too.
Yes. Potassium is a mineral. So yes, it will show up on your periodic table because it is a mineral, right? Vitamin K is not. So what is vitamin K for?
Clotting.
Clotting. Very good. So, you know, when babies are born, most of them, unless mother or father has objected, will get a vitamin K injection because their bodies are too immature to be able to produce those clotting factors. So we give it to them. We help them out a little bit, right? So we give them that injection. So remember that vitamin K is for clotting. Potassium, whose symbol is K on the periodic table, is not the same thing, okay? So vitamin K, vitamin, potassium is a mineral, electrolyte, okay? So we said it's for clotting. We can give vitamin K sub-Q as an injection. It can be taken orally, IV, or IM. So it can be given in almost any preparation. What medication should, if a patient is taking a certain medication, what medication would it be if you tell them not to eat a lot of foods with vitamin K in it? I don't know if that makes sense.
Wouldn't it be
A blood thinner, right?
Which one? What was it?
Heparin.
Miss White, you said something. I didn't hear you.
Lovenox.
But isn't it diuretic? I forgot.
Some of the diuretics too. No. That's potassium. That's potassium.
Is it heparin or Lovenox?
You're close.
Coumadin, or what's it called?
Coumadin.
Coumadin.
Very good.
See, I knew that.
Yes.
Somewhere in my brain.
If your patient's taking Coumadin or warfarin is the name, it works against vitamin K. So your patient's not going to be eating a lot more vitamin K if they're taking that medication. Okay. What foods are high in or rich in vitamin K?
Vegetables.
Fish oil.
Spinach.
Yes, spinach. Your green
Kale.
leafies. Kale, cauliflower, broccoli. Once again, liver. Eat all the liver, guys. It's got all the things you need in it. And eggs. All right. Minerals. We'll talk about this real quick, and then I'll let you guys take a short break, and then we will come back for our little test there. Not test, assessment. Minerals. 19 inorganic substances. Those are present in the body. 13 are essential to normal metabolism, and you have to get them, some of these from outside the body. Sometimes the body doesn't make these things. You have to get them from outside, right? If you like chemistry, these minerals, like the periodic table and things, you'll know that there's ions, there's positive and negative charges. Easy example is H2O, because O has -2 charge, hydrogen has +1 charge, and everything likes to be equal. So you have to have 2 hydrogens for the 1 oxygen. So that's why you're H2O. That's a fun fact. It's not going to be on a test. All right. So we'll just talk about a few of them. Calcium being a very important one. This is great for reducing the risk of osteoporosis. So you do need it in your body. You need vitamin D for the best calcium absorption if you're taking it. And you should take it with food. If you're taking calcium, take it with food. All right. That is because the stomach acid that you produce when you're eating will help to absorb that calcium better. Okay. Great. Do not take calcium with a multivitamin. Most multivitamins contain iron. We know that you can't take iron with dairy products because it will decrease the absorption. So if that iron is in your multivitamin, then you cannot take calcium at the same time as your multivitamin. Okay. It will decrease the absorption of iron and zinc and magnesium, but most importantly, that iron. Okay.
I've heard for absorption reasons, you should take vitamins in the morning and minerals at night.
I have not heard that before, but that sounds good, because those vitamins, you don't want them to alter your minerals, the absorption. So that's a good idea. Okay. What food sources for calcium?
Dairy.
Dairy, absolutely. Your green leafies. The fish with bones.
Jinx, Talise.
Orange.
So yes, all of those are great. Fish with bones, because I know how much we all love sardines and anchovies.
Yeah.
Those are great sources of calcium. If you like Caesar dressing is made with anchovies with the bones. So
Ew.
you're already eating it. It's good stuff. All right.
Yeah, I like that.
It's good stuff, I'm telling you. All right. So calcium, we know it's great for muscular and neurologic activity, right? It is great for muscle contraction. It's great for blood clotting. I'm not going to read all this stuff, but it is also essential for proper myocardial function, right? Your heart needs calcium. Okay. We already talked about hypercalcemia. We said if your patient is taking too much calcium, if there's too much calcium in the blood, then they're going to have nausea, vomiting, maybe some stones. We have some rolling stones somewhere. Okay. Right. And you'll make sure that you would be teaching your patient which foods that they should be eating more of to get more calcium in their diet. Like we said before, if you're eating a healthy diet, then you should be getting all of these vitamins and minerals with your diet. That's how we should all be, but unfortunately, it's hard. All right. Iron, we said for sure, we want to make sure that if we're taking some iron, it's a great idea to take it with some orange juice because it will enhance the absorption when it's taken together. Okay. We need iron because it is essential for the myoglobin and hemoglobin. Okay. Right. And you guys will learn, you'll get more in depth about some of these things when you talk about iron deficiencies, any of those anemias when you get to med-surg. Okay. If your patient has iron deficiency anemia, you will experience, or not experience, but you will notice that they might be very tired. Their body's not making that hemoglobin. They're not transporting that oxygen like they should. And so they're very tired. They might be pale.
Oxygen and sugar?
Sugar.
Or like glucose? Doesn't that help too? Transport glucose? No?
Huh?
Okay, never
Sorry.
mind.
Oh, hold up. We're talking about iron. And you need iron
iron
for your red blood cells, right?
Oh, okay.
The iron binds to the hemoglobin, and it helps to transport that oxygen in your body. So if you don't have iron, it can't transport the oxygen. So that's why you'll notice some people who have anemias will have a higher red blood cell count because your body is designed to try to fix the problem. So, oh, you don't have enough red blood cells circulating around. That must be meaning I need to make more red blood cells, right? And it's still not getting enough oxygen because you don't have iron in your body. So they'll be
And won't
pale.
they be like tired and lethargic and also for females that have iron deficiency, it may make their menses heavier.
Yes.
It causes heart.
Especially with the cold.
It causes a heart condition too.
Tachycardia. Yeah.
Yes, it can
you
cause
to
tachycardia.
Right, you're always tired. You're having problems breathing.
So if you're thinking about that tachycardia, your body is still saying that you don't have enough oxygen. So we're trying to work more to get more oxygen. So your heart's beating faster, right? Shortness of breath because we don't have the oxygen circulating. So like I said, you'll learn this when you get to med-surg. It's not really for here. I'm just giving you the rundown. If your patient is taking iron, they cannot take their iron with antacids or milk or eggs. Okay. So if you eat eggs every morning for breakfast, please do not take your iron with your breakfast. Okay. Great. We already said it is increased with vitamin C. If your patient is taking tetracycline, the absorption will be decreased by iron. So that's something that they'll have to work out with their physician beforehand. What the good might outweigh the bad. So you have to figure out what's more important, getting rid of this infection with this medication that we know is going to work, and then we'll continue with our iron afterwards. Excuse me. Your iron can give you some GI effects. So tell your patient if you're taking iron, you might get heartburn, you might have a little nausea, you could get diarrhea or constipated. Important, your stool may turn greenish or blackish or greenish or grayish black, which is normal for someone who's taking iron. All right, so this is one of the things we're looking at when we have babies come in and their iron has been low. If they poop while they're in the office, we look at that because we can tell if you're giving your baby their iron or if you're not. Okay.
So if a baby is missing iron, Their poop is green or dark?
Yeah, if we're giving you iron supplements for a
Oh,
baby
okay.
or for an adult,
But
it
just
should
like on
turn
a
their
regular
stool.
basis, if
Yes,
it's
it's
not.
normal.
Oh, okay.
No. Babies don't normally have green poop.
So if they're not taking extra iron, but they actually have a green poop, does that mean that they are not getting enough iron?
No, that's not what that means.
Okay.
If they don't have enough iron in their system, that's a whole nother thing. If they're taking, what I'm saying is, if parents tell us if they're taking the iron or they're giving their baby the iron, we can verify that by the way their poop looks.
Oh, okay.
That's what I'm saying. So, that's one of those things that you need to tell your patient, because they're maybe used to their poop being a certain color, right? And all of a sudden now it's greenish or it's grayish black. They're going to be like, oh my gosh, I don't know what's going on. I'm going to the emergency room. Okay. So always tell your patient that that's a side effect to look out for. Okay. Now we're taking the potassium, not vitamin K, but potassium. It's very important for your cells in your body. Right? It's great for renal function, muscle contraction, and transmission of nerve impulses. So potassium is very necessary in your body. Right? If you're taking it, be on the lookout for nausea, vomiting, confusion. Right? Those are probably more often associated with early signs of an adverse reaction or toxicity. If you're taking too much potassium, we all know that's the drug they're going to give you if we are doing the lethal drug injection because you're incarcerated and have killed someone or whatever they're giving it for. They're going to give you potassium. Okay. Because it will cause that irregular heart rhythm and you can die, or you will die if they give you enough. For nursing purposes, if you're ever giving someone potassium through their IV, even if the doctor doesn't order it, put them on heart monitoring. They need to be on telemetry, okay? Because we want to make sure that we're not about to kill them, all right? We want to make sure there's no cardiac anomalies happening when you're giving this medication, okay? All righty. And if you're giving those potassium sparing diuretics, be on the lookout because you want to make sure that your patient's not eating more potassium containing foods, because then they're going to become hyperkalemic. Okay. Any questions?
Do we get a review for this exam or no?
For next week?
Yeah.
I don't see a review posted anywhere for this exam for next week. I can tell you what's on it. Hold on just a second. Where did my little thing go? Hold up. Drug therapy for CNS problems.
Can you wait 1 second?
Uh-huh.
Okay, well, I'm ready when you're ready or when everybody's ready.
Ready? All right, this is drug therapy for central nervous system problems, hormones and drugs for osteoporosis, drug therapy for diabetes. So all those insulins and things that we talked about last week, know all of those. Drugs for ear and eye problems. So what we covered today, over the counters, herbals, vitamins, minerals, all that. Okay. All right. I don't want to promise you guys a study guide because I have a lot going on right now. I'm still prepping for next semester and there's only one of me. And so I'm trying to get everybody's things graded and ready for the end of this semester. And I don't want to promise you guys a study guide, but If I can get to it, I'll make you one, but if I can't, then this is what you have to go on, all right? So whatever has been covered in the last, I don't know, what, 2 weeks? 3 weeks? Is what will be on that exam next week, okay?
Oh,
many
that's all
questions
We
is it?
appreciate
I
you
thought
very
this was
much.
like a
Professor
final.
Duhan.
No, next week is just a regular exam.
Oh,
How many questions, Ms. Duhon? More
It's
or
hard to
less.
say.
I mean, is it going to be like the one from yesterday, or is it going to be like shorter
For next week's test,
on the exam 4?
exam 4 is just like your other exams that you've had for this class.
Oh, okay.
But you guys are getting ready to take an assessment for this class in just a second. So let's take a break. Let's go for, let's say about, let's come back at 2:50. This little assessment that you guys are going to take is only 50 questions. So, all right. Break until 2:50. Practice A. Where is it? Where to go? Oh, I know where it is. All right, everybody coming on back to the Zoom. Where is everybody? Here we are. All right, so go ahead and log into ATI. Make sure you sign into the chat, by the way. FYI, the M&M of the year for the season is sugar cookie. If you're into M&Ms like I am, they always have a different flavor for every holiday season. The sugar cookie one is really good. That's just a side note, just in case you'd like to ruin your teeth like I like to ruin mine. All right, so you're gonna log into ATI. And then you will go to my ATI when you get there. And what we're looking for is not going to be under the Attest tab like it normally is. We're going to go to the Improve tab. Type it in the chat for you. ATI. And then my ATI. Improve tab. And you'll notice once you get under that Improve tab, everything's broken down into the different areas that you're learning. So the first one that I can see on my side says Adult Med Surg. So, and then there's fundamentals, there's leadership, all that kind of stuff. You're going to scroll all the way down until you see farm and dosage calculation. And then can you tell me what you guys see when you get to the farm and dosage calculation? Because I'm not sure if everything is there for you guys.
Maybe I'm in the wrong spot, but where did you say go after my ATI to test?
No, you go to the Improve tab.
Improve, okay.
Uh-huh.
I have PN Pharmacology 2017, PN Pharmacology 2020, and then Online Practice 2017A, Online Practice 2017B.
Okay.
And then the last two are 2020A and 2020B.
Okay, good. All right, so we have the same things. So I want you guys to take the one for Online Practice 2017A. Type it in the chat. Practice 2017A. All right. Once again, you may not know all of the meds, but make your best guesses on the ones that you're not sure of at all if we haven't covered them. For the others, when they ask you the questions, make sure you do your ABCs if it's going that way. Did it show up there for you? Is that testing or is it only giving you like an option to study?
No, it's a test.
Okay, good. All right. So good luck. You guys will do fine. Once you're done, you can log out. We're all done for the day once you're done, okay?
Mine is saying it's disabled by instructor. It's the Adult Medical Surg Online Practice 2017A.
Nope, that's not what I said, ma'am.
Oh, which one did you say?
Check in your chat. I typed it in there for you. We're doing the PN Pharmacology Online Practice 2017A.
Yeah, 2017A, or is that not what I'm hearing?
Are you in pharmacology section?
The tab is pharmacology and dosage, Bree.
Oh,
Once
you
okay, I'm
scroll
sorry. My
down-
computer keeps, I'm sorry.
Yeah, scroll all the way down, and then you'll see a section that says farm and dosage calculation.
Okay. Yes, I'm there now. Sorry, I couldn't hear, like it kept cutting off,
You're good.
and like Zoom keeps kicking me out. I'm sorry.
You're good. Yes, you can go ahead and start once you're in. All right. So everybody's silent now. I'm going to go silent. If you have a question, just text me. Okay. Once you're done, you're free to go.
Nurse Duhan, it allows us to see it afterwards. Are we able to go back to it later?
Sorry, I'm on mute. Can you text me so we don't disturb anybody texting? I mean testing.